I pushed the wrong button, stopped the video. I think I was talking about the etiology of addiction, you where, to what can we look to explain why someone has become addicted or why addiction occurs. And there are several examples given here. I just want to highlight or touch upon a few of them. The first is the personal responsibility model. People become addicts because that's what they choose to do. And this is where certainly uninformed people go for their answer. Some uninformed people go for their answer because they simply don't know what addiction is about, and because they want to blame or to judge. And people are weak; they can't stop their use, etc. This is an unfortunate answer that people want to use, and it's becoming less commonly applied, fortunately. The dispositional model, one is predisposed to substance abuse. This overlaps a little bit with the personal responsibility model in some people's minds, but it's a disease approach, genetic predisposition, and that the person is not fully responsible. There's still some blame being placed, if you will, by some folks. But there's a lot of research underscoring the viability of this model to explain addiction. Cultural. This is the result of a person being immersed in a particular cultural environment, and that's what led to their substance use. Now, a good example of this is college binge drinking. A lot of young people binge drink while in college. It is for many people, normative behavior in the college culture. For most of these people, when they leave college and they go to work, and they start a family, they go to graduate school, whatever it may be, this binge drinking pretty much stops for most people. And so it's a good example of behavior that it kind of erupts or grows out of the cultural milieu. And when that individual leaves that milieu or that culture, that environment, that behavior stops. The public health model, which is the most comprehensive one, and it's looking at almost all dimensions of an individual's life or social life. And it really helps to explain addiction, I think, in a comprehensive way, because it's looking at the agent, the public health language here, the agent, which is the drug, the host, which is, of course, the individual that's using this drug, and then the environment. Now, to go back to the host, there may be this predisposed in nature because a parent or a grandparent had an addiction problem, or there may be other characteristics of the individual that are contributing to this, depression perhaps. And then the environment, again, college, maybe it's a stable family life, or just the opposite. And so by looking at the agent, the host, and the environment, you're really looking at all the various dimensions that might help to explain addiction for an individual or more broadly in society. So chapter 2 answers a lot of questions, raises questions, helps perhaps you to form your own position on what you think addiction is. Okay, then chapter 3, how do drugs work? There's kind of basic information here. This could be a refresher for a lot of you, and it's always good for us to revisit this material, though. And in this chapter, we look at the routes of administration. How does someone use the drug? The different types of drugs and classifications, and what the effects of those drugs are. And so in those three ways, the routes of administration, the classifications, and the effects, we can help and understand what it is that drugs are doing to an individual when they're introduced into their body. Routes of administration, injection, heroin primarily is injected, although in the last, 15 years or so, younger people, largely white, being introduced to heroin by smoking it or snorting it as a more common means of ingestion. Injection also with methamphetamine and cocaine, not uncommon. Typically later in someone's use of those drugs. Initially, meth and cocaine are going to be snorted or smoked, but ultimately injected if someone remains dependent upon them. Now, speaking of injections, I want to mention needle exchange programs, which we'll come back to in the course. Needle exchange programs as an example of harm reduction. Now, harm reduction is controversial for a lot of folks because the goal of harm reduction is not necessarily abstinence, but rather to reduce the risk to the user in various ways. One of those is needle exchange programs, wherein people who inject drugs are provided with clean needles by outreach workers, or maybe they may go to a clinic to get them. And the idea is that by providing injection drug users with clean needles, we're going to lessen the chance of the transmission of diseases, HIV, hepatitis, whatever an individual may have. They inject with their needle, they share it with someone else, and the diseases are transmitted in that way. The arguments against needle exchange programs include you just encouraging drug use. You're not only encouraging it, you're aiding and abetting by giving them needles. Well, the reality is they're going to use anyway. They'll continue to use dirty needles if that's all they have. So it's a public health approach to reduce the spread of disease, reduce harm to people, including in some cases innocent people. We're talking about sexually transmitted diseases. And so it has its benefits, it has its controversy as well. The other benefit, though, in addition to lessening the spread of disease, I've just lost it again, sorry. This gives us entree to addicts. If we as outreach workers are providing clean needles to people wherever addicts are gathering or wherever they're using, we're able to speak with them and talk to them about treatment opportunities, talk to them about other services that are available to help them, non-treatment services. It may be SSSI, it may be SNAP or food stamps, whatever it's called in your area. Whatever it may be, it's an opportunity to provide social services to people who are in need of them. So needle exchange programs are growing. They're becoming more accepted, even by some folks who are more conservative in their attitudes about these things. And it's an example of harm reduction, which we'll talk about in some other ways in the course. Okay, now in this chapter, the neurochemistry of addiction is presented to you. We talked about this in some of the videos. Some of you have studied this elsewhere. But we're looking at brain chemistry, if you will, neurotransmitters, which are serving as keys to unlock receptor sites to allow the brain to function in different ways and respond to different inputs, if you will. So we have these naturally occurring chemicals in our brain, these neurotransmitters, that provide certain things to us, dopamine being one of these that we've already talked about and you've heard about, helping us to deal with pain, providing us with feelings of pleasure. So natural activities, sex, eating, the enjoyment one gets from, holding their child, whatever. Those naturally occurring activities result in the release of dopamine in our brains and giving us these feelings of pleasure. When we enter drugs into our system, exogenous substances that are similar chemically to these neurotransmitters that open the receptor sites, like opiates, like heroin, continually introduce those brains into our system, our brain is limiting its production of dopamine because these external substances are generating that for us over and over and over again. And so we're providing those neurotransmitters, so to speak, from outside. And when you stop using the drugs, your brain is not producing dopamine at the level you need it just to deal with ordinary facts of life, dealing with simple things. You're not able to experience pleasure. You're not able to deal with pain. There are feelings of malaise. And so the way we know we feel good is when we were using that drug that we've been using for the last weeks or months or whatever. So we relapse and we go back and we use it because we just want to feel well again. And it's going to take a while for the brain to respond. And so if the drug is gone, we've got to replace it with something else. Otherwise, we're not going to feel well enough and we're going to go back to the drug and use it, sort of in a quick and dirty explanation. So again, a disease of the brain. It's not that people are weak. It's not a question of not having any willpower. They're just not able to deal with it in a neurochemical way. The brain has been hijacked, as we say. On page 42, there's a little box 3.4 that shows the risks of dependence by drugs. Take a look at those and see if you're surprised by any of those on page 42. And again, this may be something that you might want to post a comment about. Okay, so that's a quick review of chapters 1, 2, and 3. If you have questions, opinions, post them in our discussion board. All right, take care. I'll talk to you next time.